Good morning, good afternoon, good evening. Welcome again to Mizan Coaching or Dr. Mizan Coaching. I am Dr. Mizan. Again, for those of you who are new to my channel, I am a medical legal consulting physician. I'm a family medicine physician that basically shifted careers, went from clinical medicine, working in a clinic and a hospital setting, to providing medical legal advice to patients, hospital systems, clinic systems, attorneys, everyone really. This is a very niche field, and so I felt it was a sort of a moral and ethical obligation of mine to sort of spread this knowledge via YouTube and social media. So welcome to my channel for those of you who are new. For those of you who follow my channel and for those who don't, please subscribe and post a comment. Post any questions you may have, any issues you may have had with the healthcare system. I talk a lot about very common medical legal questions, but I also talk about the state of the healthcare system in general in the United States. I might link those videos down below just so it's easier to watch those. But without further ado, today's episode of Medical Legal 101, again, this series is where I just sort of give a brief introduction to what are the most common case types that I assist with, basically. So patients come to me, hospital systems come to me, attorneys come to me and say, hey, Dr. Mizan, I need some help figuring out if this was done correctly, and if it wasn't, what should I do about it? So today's episode is on surgical complications. So believe it or not, and this shouldn't come as any surprise, but a lot of surgeries have complications. And I would say, just based anecdotally, about 10 to 15% of any surgical procedure will have some sort of complication. And out of that 10 to 15%, maybe about 2% or so will lead to some sort of what we call damages. So damages in the legal term is an injury that actually can be litigated against. So, if someone needs an additional day at the hospital, it is a damage because there might be some economic loss, but usually it's not that big a deal. But basically this episode will be on, some advice for if there are surgical complications and ways to protect your practice if you are a surgeon, and if you are a patient or the family member of a patient that has experienced a complication, what do you do, right? Okay, so some examples of surgical complication cases that I've actually assisted on in the past 4 or 5 years. So a lot of them are botched plastic surgery cases. And this sort of makes sense because the people who tend to get plastic surgeries, they're at a higher SES, socioeconomic status. They have more money to spend on attorneys, etc. The thing is though, like medical malpractice attorneys, they don't take a penny from you until settlement or until the case has concluded. So that's something important to know. So this is one advice I give to patients and everyone really, including my family. If you suspect that there was medical malpractice, just go for it. Go get an attorney, get a med mal attorney, consult us at Mizan Coaching, and it's with the attorney, it's completely free until the case has concluded. At which point they just take a percent of the settlement. A settlement verdict. So it's not like you have to pay them necessarily. It's that, the pool, they take a percentage of the pool. Anyway, so there's botched plastic surgery cases, a dime a dozen, like a botched rhinoplasty, botched ptosis surgery, lots and lots of botched breast augmentation or breast implant cases. For example, like, I had one case where, the plastic surgeon was, not board certified, barely did any breast surgeries, but he basically said during the introduction interview with the patient that, he was an expert of breast augmentation, breast implants. But, he did a horrible job. It became, in fact, like the implant actually was misplaced. It led to an infection. The patient went into septic shock, and then they had to remove it. They had to remove, viable breast tissue as well. So the damages were really great for that one. We also have, outside of plastic surgery and just normal general surgery world, I've done cases where, during the surgery of, there was a nephrectomy. A nephrectomy means a removal of a kidney, where the surgeon accidentally nicked one of the vasculature. So I think it was a renal vein or something. but the patient basically bled out and died on the operating table. So, you know, these things happen, and you can imagine any other type of surgery permutation, right? Like you could imagine what the cases that I've seen. I've done hundreds of these cases. And what I do basically is I just provide the doctor perspective on whether a case is viable or not. Okay, so these are examples of you know, surgical medical legal cases that we work on. So the thing that we focus on is something called standard of care. So standard of care, if you've seen my other videos, basically means if you have 100, this is the way that I define it. If you have 100 doctors of the same specialty, what would the majority of them say? How would the majority of them do something, right? So for example, like if you have an infection, what antibiotic would the majority provide? And this is, you know, based on peer-reviewed evidence, etc. So for surgical cases, I'm not a surgeon, but for surgical cases, we look at what is the common surgical technique that's necessary for like a nephrectomy or a cholecystectomy or a breast augmentation surgery, right? Like if a surgeon is using a more experimental or a new technique, there needs to be informed consent. Okay, so now let's talk about the informed consent form. So every single procedure that you as a patient get, there needs to be an informed consent form. So, and in the informed consent form is written all the risks, all the benefits, you know, this could happen, that could happen. And what is the surgery, right? Like in basic, like layman's terms language. And of course, like this includes known complications. So known complications, for example, if you get whatever, like thoracic surgery for a cardiac valve replacement, you might die, right? So dying is a known complication, but does that give immunity to the surgeon? No. So just because something is a known complication, if a surgeon is distracted, if a surgeon makes a mistake, they still are liable for that mistake. All right. So when we examine these cases, we look at quite a few things. We look at obviously the operative note. We look at the pre-op note, the op note, which is really the meat, and then the post-operative note. Like, did the patient recover well in the PACU? The PACU stands for post-anesthesia care unit. But usually it's the operative note that we care about. So looking at the op note, you know, so we look at the technique, we look at the pre-procedure diagnoses, the post-procedure diagnoses, what surgical techniques did the surgeon use? And yeah, so that's really it. And then we have our team of surgeons who have done these procedures. They can opine, they can give opinions on whether it was done correctly or it was not done correctly. Okay. And so what's my advice here? So for patients, my advice would be always ask, okay? Like we doctors are your servants. That's why we became physicians, right? Like it's to help the people. We are patients ourselves, right? So, you know, it is your right to ask your surgeon, to ask your doctor, what is going on, right? Like what's going on with my mother, my father, my sister, whatever, like whoever is in the OR. You know, what is the plan? What techniques are you going to use? Feel free, you know, like if a doctor is nice and has time, they're going to sit down and talk to you about it. They're going to offer you some degree of comfort. And then, you know, afterwards, like ask them, how did the surgery go? Like, you know, were there any complications? And, you know, hopefully they'll speak with you. All right, for my fellow doctors, including surgeons, very, very important advice here, okay? Like, again, my job is to prevent litigation from even occurring. That's literally my job here. So to all my surgery colleagues, use good, established, peer-reviewed techniques and document honestly, all right? And I mean this like based on hundreds of cases that I've been involved with. So, you know, if something bad happened, if there was a complication, if there was a mistake, document it, because you don't want it to be found out later. And then, you know, then you're going to have to be in a deposition. You're going to have to explain to a very aggressive attorney as to why you did the thing you did and you did not let anyone know. If a family finds out, then, you know, there could be a lot of things. It's the same thing in like human behavior, right? Like if you made a mistake, just own up immediately and ask, you know, make amends and move forward. That's it. Because surgery is very different from general medicine, right? Like us general medicine doctors, it's really like chronic issues, and like we have continuity with the patient. For surgery, it's you just do a thing and then the patient is gone, right? So there might be a post-op follow-up visit, but yeah, again, so number one, use good established techniques, and number two, document honestly. And again, I'm not a surgeon, so take all of this with a heavy mountain of salt. But again, these are just the anecdotal evidence I have from the hundreds of cases I've been involved with. Okay, so yeah, so that's really it. And one of the most important things is keep your patients in the loop and their families in the loop, right? So, and again, we all know this from med school, like bedside manners are the key. And really it's rapport. So it's bedside manners and rapport with your patients. Like that's what will prevent litigation. Because then everyone is on the same page. They know that you're a trustworthy, honest physician and surgeon. And for patients, again, like the thing that I mentioned to everyone, including my own family, ask questions, okay? Always ask questions. It's your life. Your voice matters. Your family member's life matters, and their voice matters. And physicians, like part of the Hippocratic Oath and part of why we became physicians is to be servants of the people. Yep, so that's about it for surgical complications. Check out my other videos on just Medical Legal 1. I have advice on everything, really, like how to document cancer cases, where I talk about delayed cancer diagnoses. There's how to deal with hypertensive emergency versus urgency. There's documentation tips. And yeah, and I have now dozens of shorts on very fascinating, what I call bizarre medical legal cases. That are really fun to watch. So yeah, thank you again. Please subscribe, comment, share these videos with whomever you'd like. And until next time, take care. Bye.